stock to clear the backlog of surgeries. And as a part of COVID-19 fall preparedness plan, we're investing over $741 million to accelerate efforts to reduce surgery backlogs. That's over $283 million to support more priority surgeries for patients. For cancer, heart disease, cataracts, tumors, spine injuries, and many, many other procedures. This will also help us extend hours for MRIs, CT scans, and other diagnostic services. That will allow us to perform over 50,000 more surgeries and up to 184,000 more MRI and CT scans. And we are also adding over 1,400 more beds and care spaces for surgeries. We know every additional hospital bed we secure puts us in a stronger position to fight the next surge. Every hospital bed we free up, it can make all the difference in the world. That's why we're investing over $457 million to build our surge capacity in our hospitals across Ontario and expand care in communities and in homes to reduce pressures on our hospitals. We're helping 20,000 more seniors and patients transition from hospital beds to long-term care, home care, and alternative care. We're investing $100 million to deliver 484,000 more home care visits. This one stat just amazes me. That's 484,000 more home care visits, and this is an amazing number, and 1.4 million more hours of care from personal support workers and the PSWs. I love you guys. You're absolutely amazing. All of these measures taken together will ensure our hospitals have the capacity to care for COVID-19 patients. It will help us reduce the surgery backlog while still ensuring all patients receive the care they need. And earlier today, we announced further restrictions to stop the spread of COVID-19. Effective today at midnight, all bars and restaurants will be only permitted to remain open until midnight. All adult entertainment clubs will be closed right across the province. All businesses and organizations will be required to implement screening procedures for their workers. And tomorrow, going forward, restaurant and bars must stop serving alcohol at 11 p.m. and close their establishments by midnight, except takeout service or delivery. I just want to repeat that again. Tonight, they close at 12 o'clock midnight. Tomorrow, they stop serving alcohol at 11 p.m. and close their doors at midnight. Lastly, I'm also pleased to announce that next week, this is the great pharmacies, and I got to give a shout out to shoppers, up to 18 more pharmacies in southwestern Ontario and Niagara region will begin offering testing as early as this Tuesday, including locations in St. Catharines, Niagara Falls, London, Windsor, Sarnia, Brightsgrove, a suburb of Sarnia, Kitchener-Waterloo, Cambridge, Brantford, Chatham, Stratford, Woodstock, and St. Thomas. And we're going to keep expanding to more pharmacies across the province in the coming weeks. But the biggest thing we can all do is to make sure surgeries are not delayed, to make sure we have enough hospital beds. It's to follow the public health measures, wash your hands, practice physical distancing, wear a mask, and please get a flu shot. It's these simple things that can save lives, and it's up to all of us to do our part. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. Well, there's no doubt we are living in unprecedented times. The COVID-19 outbreak in Ontario meant that we had to take extraordinary measures to keep the people of Ontario safe. That included having to put important medical procedures on hold to ensure the safety and well-being of all patients within our hospitals. We know how stressful this has been for patients and their loved ones, which is why our government is working very hard to create the capacity needed to address the backlog so that patients can get the care that they need. That's why we're investing over $283 million to reduce health service backlogs and over $457 million to expand access to care as part of our plan to ensure that we are ready for ongoing waves of COVID-19. To safely reduce the backlog for health services, this investment will support additional volumes of priority surgeries like cancer, cardiac, cataract, and orthopedic procedures. We're also extending diagnostic imaging hours at healthcare facilities for MRIs, CT scans, and other critical procedures. In addition, we are adding an additional 139 critical care beds and more than 1,300 additional patient spaces in hospitals and alternate health facilities across the province to support increased surgical activity. And as part of our plan, we will be initiating a centralized wait list and a program to optimize the use of the operating rooms and improve the use of existing resources. This program will help improve the efficiency of our existing resources and increase the number of surgical procedures in our hospitals. To ensure that the health system is prepared to respond to any surges of COVID-19 without interrupting routine health services, Ontario is investing nearly $500 million to increase community capacity. This also means that more patients can receive the care that they need closer to home or in their homes. This includes investments in home and community care to help reduce pressure on hospitals and expanding digital and virtual healthcare services. Our government continues to work to keep hospital and alternate level of care capacity available for patients by increasing the availability of home care, more home care for patients, by increasing access to mental health and addiction supports across the province, and by optimizing the delivery of virtual care. We are working directly with our healthcare partners to ensure our health system is ready to respond to the challenges that we face with future waves of COVID-19. And we remain so thankful to our brave frontline healthcare heroes who continue to act in the best interest of their patients day after day. But over the past 5 weeks, we have seen an increase in the daily rate of new COVID-19 symptoms. We need to take steps now to protect Ontarians and to help our frontline healthcare workers to continue to do the excellent job that they're doing. Earlier today, our government announced additional public health measures to reduce the risk of transmission and to prevent future outbreaks, including additional measures for restaurants, bars, and other businesses serving food and drink. These measures also include the closure of all adult entertainment clubs, and by that we mean strip clubs, and require businesses to comply with any advice, recommendations, and instructions issued by the Office of the Chief Medical Officer of Health on screening individuals who wish to enter their businesses. These measures are designed to address the rapid increase in community transmission in order to keep schools, post-secondary institutions, and businesses open, and of course, to protect our most vulnerable residents. Together, we will continue to work to protect the health and well-being of all Ontarians. That is our top priority. Thank you.
Okay, we'll go to the phone line for questions. First question, please.
Will be from Jason Chapman at 640 Toronto.
Hi, Jason.
Hi, Premier. Thanks for taking the call on a Friday. Premier, this week you've said that test lineups have been caused because of a lack of action by Health Canada. But, Premier, I want to tell you that more and more we're hearing from parents, and that test lineups aren't there because of Health Canada. They're there because Ontario has a policy in place that says that kids can't go to school if they have a runny nose. Now, I know your education minister mentioned that that's being reviewed, but I want to really get a sense from you and the health minister. How much longer will that remain symptom that doesn't allow kids to go to school when Health Canada, I believe the CDC and WHO don't list it as a significant or often symptom of COVID-19?
Well, first of all, thank you for the question. Before I hand it over to the minister, Health Canada plays a massive role in this. There's obviously other areas too, but a massive role. Just imagine if we had the rapid test approved, that we don't have to go into the labs, and because we're short on lab technicians, we maxed out the province, so there's lab technicians by all means. We need your support, but 100% they played a role in it. Not even a doubt in my mind. And just think, if we had the rapid test, we could find out if someone has symptoms, and then they can go to the next step, which is a nasal swab. But I'll pass it over to the minister. But I want to emphasize, Health Canada plays an absolute critical role in getting these approved. There's no doubt in my mind, 100%.
Well, thank you for the question. And there are really two ways that we can deal with this issue, because we know that many children have runny noses throughout the school year, but they're otherwise healthy. So we have referred the issue to the health measures table and to the Chief Medical Officer of Health to look at redesigning or looking at the symptoms that are indicative of COVID to allow for children to stay in school if it appears that it is only a runny nose. But the way that we can be helped by that, of course, is with the very large contingent of health nurses that have been hired to be part of our schools, to have a family of schools that they're responsible for helping. And we will have 625 nurses available shortly. We've hired well in advance of 500 now, but they will also be available to look at a child's symptoms to see if they view it as a problem or something where the child can remain in school, or whether it is more significant and they do need to be tested. So we are working on that now because we recognize some of the challenges that this is posing in our educational system.
Follow up?
So, Minister, I'll just ask for some clarification. Do you see a time this school year when students will be able to just go to a school before being assessed if they just have a runny nose, or will they need to see a nurse, like you've mentioned, each time before being allowed to go to school? And will that tax the healthcare system?
Well, I think, first of all, it's important for all parents to use the screening tool that's available every day with their child to determine how they're doing, and to understand that if it's something that appears to be more significant than a runny nose, if they have a temperature, for example, that will be, of course, up to the parents to keep the child home and then to seek the test themselves if they feel that is necessary, or to seek the advice of their primary care physician or a nurse practitioner. But as time goes on, we are looking at revising the list of symptoms, and of course to work with the public health nurses that will be there in the event that there is a child that shows up with some symptoms that may be more significant than simply a runny nose. But those nurses are going to be invaluable in helping us with making that determination.
Next question
is from Lucas Meyer at Newstalk 1010. Please go ahead.
Thank you very much. Premier, first one is just an issue around language. There seems to be some interesting semantics around various medical officers of health and the Prime Minister of whether or not we are officially in a second wave or if it's coming. Yesterday you said we always knew a second wave was coming. So I think now, just very simply in your eyes, is Ontario in a second wave?
I'll pass that over to the Minister of Health. What I can say, Lucas, when we jump from under 100 cases and with a two-week span jump up over 400 cases, I'm not a medical professional. I'll let the Chief Medical Officer answer that one, but I'll tell you, we're seeing the cases jump literally in a 2-week span. Under 100 jumps up to 400. So I'll pass it over to the Minister.
Well, I would certainly leave that determination to the Chief Medical Officer of Health to say whether we are in Wave 2 or not. But we are certainly seeing a worrisome increase in cases, having cases now that are above some of the levels that we've seen since late May, early June. So this is the reason why we're having to bring forward some of the measures that we are today. When we see a doubling of case numbers every 10 days, that it indicates that it's time to act. And so that's why we are taking the measures that we are today based on the advice that we've received from the Chief Medical Officer of Health and the health measures table.
Follow up?
Thank you very much. And on the restrictions, did the government make this decision to add the restrictions and take the action on strip clubs? Was this after some straightforward consultation, face to face, or speaking with the Mayor Tory and others? And will there be some sort of different kind or additional compensation on top of the federal benefits for these affected businesses?
Well, what I can answer is that we take our advice off the Chief Medical Officer and the health table. One of their recommendations came forward regarding those establishments, and we're going to continue taking their advice. I know Mayor Tory's other mayors have called me up and they're concerned about the bars staying open late, and I don't think it's a huge ask if they can stop serving drinks at 11 o'clock, close their establishments at 12 o'clock.
Next question
is from Cynthia Mulligan at City News. Please go ahead.
Hi there, Premier. You're getting criticized by the opposition for saying that you've kind of been caught flat-footed and you're making it up as you go. And I'm trying to get a sense from you, is there some accuracy to that, or is the landscape changing so rapidly that you have to pivot constantly? How late are you making these decisions? Is it late the night before because you have a whole bunch of new information, or is this, a lengthy process?
Well, I can tell you the fall preparedness plan has been going on for months. And yes, do we have to read and react as cases jump? There are certain areas that we have to make a decision based on the Chief Medical Officer and the health table. We'll make those decisions. But the fall preparedness plan, the minister has been working around the clock with her team getting ready for this. And that's what's happening. We've been transparent. I won't comment about what the opposition is doing.
Follow up?
I'm going to switch gears for a moment. My colleague Erica Natividad is working on the story of 2 more nooses found at the Michael Garron Hospital construction site yesterday. This is in addition to 5 nooses discovered on 4 different sites in Toronto this year. The CEO of Michael Garron is calling this a systemic issue. What more needs to be done, can be done, to address this kind of horrific racism in the construction industry and in this province?
I find it absolutely disgusting someone's doing it. And then when the police are going to catch this person, and I'm sure they're going to catch him, you'll find out it's maybe 1 or 2 bad actors, as we say. And they'll face the consequences. There's no room, no tolerance I have in Ontario for any racism. I don't care what racism it is. I have 0 tolerance for that, and I won't stand for it. So we're going to catch this person, and we'll bring him to justice.
Next question
will be from Colin DeMello at CTV News. Please go ahead.
Hello, good afternoon, Premier. This is going to be coming as a surprise to a lot of those in the bar and restaurant industry, the decisions that you guys made today. You've been saying for a while now that bars and restaurants aren't really the problem. So I'm just trying to figure out what changed. When did bars and restaurants and these hours become an issue, and what specifically was the problem that necessitated this action today?
Well, I want to, again, say I think the vast majority of restaurant owners, they have been responsible. There has been outbreaks with staff members and that, and it's precautionary. We have to be careful, and I don't think it's unreasonable that the Chief Medical Officer has requested that especially the nightclubs, that we've seen outbreaks in a few nightclubs. I don't think it's the end of the world. People stop drinking at 11 and close it down at 12 o'clock. It's precautionary measures moving forward. It won't be forever, but I agree with it. Plus, on top of that, we have Mayor Tory was concerned. Other mayors, regional mayors in the GTA have asked me to do this. We had the mayor in London asked me to do this. So there's quite a few mayors concerned, along with the local chief medical officers. It's just another step that we can put in place that will slow down the spread of COVID.
Follow up?
Thank you. And just on that, you guys see modeling data on a regular basis. Is there any modeling data that shows what the impact or the potential impact of these specific measures could have in the days and the weeks to come?
Yes, and I've always said, Colin, I did get briefed yesterday. We'll be rolling out the modeling next week. So what I've seen, we're going to roll it out next week, and the people can see it at all as well. And there's different scenarios.
Next question.
Will be from Sean Jeffords at the Canadian Press. Please go ahead.
Hi, Sean.
Hi, Premier. Wanted to ask you today about the decision to change the rules around bars and restaurants and follow up a bit on what Colin just asked there. When it comes to the rules, you were pretty strident earlier in the month that the municipalities really had the say here, that they could go out and make these changes if they need to do that. What has changed your mind? Is it just the rates, or is there something else here that has helped, I guess, if you're thinking on this?
Well, I think it's an influx of cases. As the minister said, we've seen doubling of cases in a very short period of time, and it's very, very concerning. And as for the restaurants, I'll stand up for the restaurants. These people are hurting. They're holding on by the end of their fingertips, and in the restaurants that I've went into, they're following the procedures and protocols. But there's not too many people that are having dinner past 12 o'clock at night. We're still going to keep the takeout and delivery services open, and the nightclubs have been concerning. We've heard it on the news. There's been outbreaks, and we just can't chance it. We really can't. We're seeing the numbers that are basically under the age of 40, 39 and under, and then those are the highest numbers. And I can tell you, I don't see seniors going into nightclubs too often. It's usually that age group that are going in there, and God bless them. Be careful, have face coverings, but we just can't have these places open till 3 o'clock in the morning. But we're being very balanced, I feel, very, very balanced, and so is the chief medical officer and the health team. They're very pragmatic. They understand the economy is very important, as it is to us, but number one is the health and safety of the people of Ontario.
Follow up.
And Premier, when it comes to the change in the guidance around testing, I'm wondering if you can address the communication strategy that the government is going to employ to get the word out about this, because for months the message has been the exact opposite, that anyone who needed a test could get a test. Now that has changed, but it seems like it's going to take some time for that to actually percolate and reach the public. What are you going to do to ensure that is the case?
Yeah, and I'll pass this over to the Minister of Health. Thank you.
Well, of course, we're going to continue to talk about it. I know there has been some confusion, but the situation now is that for people who are asymptomatic, but are people who are necessary workers, people who work in long-term care homes, there are teachers, there are others that can now go to pharmacies to be tested. Anyone else that's showing any symptoms or has been in contact, they believe, or has received the notification through the COVID app should go to the assessment centers to be tested. So we want to make sure that people that absolutely need to be tested, who are asymptomatic, can go quickly to receive their test and get back to work again, whether it's teachers, whether it's firefighters, police officers, or people who work in long-term care homes, or the people who are going to visit family members in long-term care homes. So we're really trying to make a more coherent system with faster responses for the people that need them urgently. And of course, we're going to continue to keep all of our assessment offices open, assessment centers open for people that need testing, who are symptomatic and need to have that test.
Next question.
Will be from Robert Benzie at Toronto Star. Please go ahead.
Hi, Robert.
Hi, Premier. Hi. I wanted to ask you, why is your party nominating its sitting MPPs for the next election when the next election is supposed to be 615 days away? What's the thinking behind that? And what's the thinking about this fundraising blitz that the Tories are on right now?
Yeah, well, first of all, the NDP and the Liberals are going hog wild and getting their members, and I have no problem with them doing that. We want to get our folks prepared for the election, and I've said before, we aren't going to be calling it in the spring. We'll be calling it the regular time. We have a mandate from the people a strong mandate. We're going to carry that forward. But it's always good to have your candidates ready, just like if you compare us, actually, the Liberals are getting more candidates. I guess they have more seats available than we do, but they're getting their candidates ready, and it's just all part of the political process. There's nothing else behind it, and we're going to continue moving forward that we can represent all regions of this province.
Follow up.
So you have you're going to be definitive, because I understand that there are some people in maybe not in your inner circle, but certainly in your party, who would like you to go and have an earlier election because the polls are very good for your party right now and for you right now, and they may not be so good 2 years from now. If we're still in recession and we don't have a vaccine or anything like that. But you can assure Ontarians that we will not have an election before June 2nd, 2022?
That's correct. We have a clear mandate from the people of Ontario, and the people will have a very clear decision. They'll have a decision about leadership. What party was able to get them through this pandemic? Who do they have confidence in getting the economy back up and running like we did when we inherited an absolute disaster when we took over? There was 300,000 jobs lost in Ontario before this pandemic. In a short period of 18 months, we were able to create an environment for 307,000 new jobs. And I remember calling the Prime Minister and talking to him, saying we need more people from all around the world to fill the vacancy of the 250,000 jobs we were short, just short as last December and January. And we're confident that we're going to create an environment that companies will thrive and prosper and grow, and therefore people will thrive and prosper and grow. That I'm confident in, and I'm confident in the leadership that the Minister of Health has shown and the Chief Medical Officer, and most importantly is the people of Ontario. Everyone's pulling in the same direction. I'm so grateful. I could not have done this myself. The Minister couldn't have done it themselves, and I just got to give a shout out to everyone, all the frontline essential service workers, healthcare workers, grocery clerks, truck drivers. I could go on for an hour. All the companies that switched over their lines to make PPE. Who would ever think I'd be standing here 2 years ago and saying some of the world's largest auto part manufacturers like Linamar here would be switching over their line from car parts to make masks. People look at us like we had three heads, but they stepped up, and I'm so grateful. We are going to get through this. We'll have a few bumps, but folks, let's just hang in there. We're doing a very good job, all working together. And again, thank you. I'm very grateful.
Last question.
Will be from Jeff Gray at Globe and Mail. Please go ahead.
Oh, hi, thanks. Hi, Premier.
Hi, Jeff.
Just wanted to ask you, going back to the bars thing, you mentioned the input from the mayors. I think the mayors, and certainly Mayor Tory in Toronto, they'd ask you to do this earlier bar hours thing back in July. Can you elaborate on why it wasn't done then, and would it have been wiser to have done it then from the get-go?
Well, we started to see a decline, if you remember, Jeff, in late July and August. We saw the numbers going down. They reached below 100 in a consistent pattern for about a week or so there, and then all of a sudden this hit us like a ton of bricks. But I'm in constant communication. The mayor, I got to give him a shout out. Mayor Tory's just been a phenomenal partner. I couldn't ask for a better person to partner with than Mayor Tory. I just finished talking to him. We talk frequently on the phone. The communication between our office and their office and all other 444 municipalities. There's not a day that goes by, Jeff, I'm not talking to at least minimum half a dozen mayors around the province, probably more. I'm being conservative. And they give me their advice. I was talking to Mayor Dilkins from Windsor. That's another champion down there. And last night, and many others yesterday. So I'm just so grateful that all 444 municipalities are working as one and working with the province. And my last shout out is the feds. Christia Freeland, been a great partner. I appreciate everything she's doing along with the Prime Minister. So everyone seems to be working well together. You know what I wish? I wish we could do this forever. I really do. People expect us to work together, and the amount that we can accomplish when we put political stripes aside is staggering. And just simple conversations between mayors and our team and myself and the federal government and our ministers in the federal government. Everyone seems to be working well together, and let's just continue doing it.
Follow up.
just back to the issue of the announcement today. With you've used the phrase COVID speed a couple of times. The strip club issue, for example, is weeks old. The spike in numbers is weeks old. I mean, is there any sense that the government has been caught behind on this kind of measure to try and catch up with these numbers that we're seeing?
No, I don't believe so. We're taking a cautious approach, but again, decisions have to go in rapid speed, and that's one of the areas that we took advice from the chief medical officer of health and their team. And these folks are some of the best health minds in the country, but they're very pragmatic. They understand the economy as well. It's just amazing how they've worked with us, and they understand that we have to keep people's livelihoods going and the economy moving, because you shut down the economy, that plays a big effect on mental health and so many other areas that are very, very concerning. So they have to do a balancing act, and that's what we do. So I think they're making the right decision. We're making the right decision as a government. We have some tremendous debates in caucus and in cabinet, like long debates too. So it's vetted. It's vetted very deeply too.
Okay, thank you, everyone.
Thank you, everyone. Have a great, safe weekend. Thank you, and God bless each and every one of you.